I'm James Chase, Editor-in-Chief of Medical Marketing and Media, and I'm at Lions Health. I think it's actually a bit of both. When you're talking about regulations as a barrier, I think inherently the pharmaceutical industry, at least in the US, is historically structured to mitigate risk and be cautious. And I think it talks a lot about things that you cannot do, particularly with the emergence of digital and social media. But there's a lot of stuff that you can do. And creativity doesn't always have to be synonymous with risk, and the same with innovation. It doesn't always have to mean risk. It can just mean something that hasn't been done before, and there's not always regulatory risk associated with that. So I think things are changing. They're changing slowly, but they are changing. I think even as recently as maybe 5 years ago, I'm not sure that was the case, but certainly I think everybody knows that they do have to change. It's just I think the pharma industry is historically structured as a series of silos, so it's very difficult to break out of this system. And the way the world is changing as well, the way the customer is changing. I mean, pharma is really set up as a transactional manufacturing business, and is now suddenly the expectation that it's a service industry offering healthcare solutions like way beyond just selling a pill. So so that whole transition is part of that struggle. But it's happening slowly. So I think healthcare, and pharma in particular, does always follow the curve of other industries. There's just always this lag of 5 to 10 years, just that sort of caution period, if you like, when we figure out, or when the industry figures out how to do some of the things that have been happening for some time in other industries. But I think in terms of creativity, we're obviously here to be inspired about creative work and to celebrate good creative work. I mean, I think we were saying in the panel, no industry has as many good stories and storylines as healthcare. We're talking about life or death situations. We're talking about people, relationships with people. We have a lot of material to work with here, and also, creative is not just the end of the process in healthcare. It can mean the difference between life or death. So it's really important that we do it and that we get it right as an industry.